on December 4th, there's going to be a lot of trans people gathering outside the Supreme Court, like to protest or encourage or whatever. The lawyer arguing for the good guys is a trans man, and he is I believe, first trans person to argue before the Supreme Court.
That's amazing.
Yeah.
I bet he's so busy right now, or else I'd be like, get on the pod.
Mm-hmm.
I'm taking notes. I want to keep track of shit. Mm-hmm. It's go time. I got to keep my notebook always nearby.
Yeah.
Granted, it's my podcast D&D Stardew party notebook, but it's still a notebook. It doesn't have one purpose. It has many.
My notebook is podcast, D&D, and therapy, which is kind of like all the same thing. So
yeah, Stardew is my therapy. It's not a good therapy, but it's my therapy. I knew the crinkling sound was nefarious. Pantry man. Trying to eat my garam masala, which is not food, it's seasoning.
He's crazy.
He's insane.
I didn't even fully realize until I saw it for myself. Crazy guy.
He's insane.
I know.
Like, there's no words that describe how extra he is.
Like, he got issues, man.
He does, but he's really cute.
Yeah.
For a poopy man, he really needs that butt shave.
He's a poopy man, but he's a lovey boy, too.
He's so lovey. He better come meet Ivy. If Ivy doesn't like him, then we cancel the episode.
Hey brats, my name is Robin and I'm trans.
My name is Ben and I'm trans.
And you are listening to Ben and Robin Are Trans, the Brat Pod. We have a special guest with us today. Her name is Ivy. She's from Flourish Advocacy. I first got in contact with her through TikTok. I know I follow her on Instagram too. My cat is tearing things up in here. That's just part of the show, though. Originally, I saw one of your videos, which was literally just talking about generally what you do, like what your job is. And like, this was a few months ago too, I immediately was like, I've been wanting to meet somebody like this. Like, it's so cool that you do what you do. And so I'm like really excited to get into that with you. But Ben and I, especially since the election and everything, we are like amping up our efforts to find people resources, and do networking and just kind of like organize as much as we're able to. So Ivy, would you like to describe your gender and pronouns and everything to us?
Yeah, sure. My name is Ivy. I use she, her pronouns, and I am a trans woman and the founder or whatever of Flourish Advocacy.
I love the name. Flourish is such a cute name.
Yeah. Yes, we're all about like centering trans joy too, and it's like important. I've been using the phrase now more than ever so much, it's like ridiculous, but it's important now more than ever. Just like the joy is everything. Yeah. Speaking of joy, do you have like a trans moment of joy that you would like to share with us?
Yeah.
Yeah.
I mean, I think, for everybody, maybe not for everybody, but at least for myself, right, the point of actually getting that care, right, and showing up to, like, the operating room, that's a pretty, like, sort of, like, watershed, substantial joy moment, right?
Yeah.
It's joy in a little bit of a sort of modified way, right? So you're not usually very happy in a hospital gown, but there's a lot of happiness somehow still in a hospital gown.
Yeah. I guess like in a metaphorical sense, you're almost like a doula for people in their transition. Like,
yeah, it seems so.
It's like a really hard time in a lot of ways because surgery, scary. But also it's like, I don't know, you get to be with people and some of like going through some of the best moments of their life too. So,
and, getting closer to this moment. It's all about, finding that joy, finding that self, right?
Yeah, exactly. So do you want to tell us just kind of generally what Flourish Advocacy is and like what you do in specific?
Yeah, sure. So the, sort of elevator pitch version is that Flourish Advocacy does gender affirming care coordination services. So
Mm-hmm.
what that means is that myself, particularly as, our client's advocate, stands right with our client, helps them talk to their insurance, fight their insurance to get the care that they desire. We do also perform some of that, doula-esque function, which is, I think, is a apt
Yeah.
comparison. If you, don't really know what you want, we help, provide that guidance as well. We've done a bunch of different things. We've helped people get electrolysis. We've helped people find
Mm-hmm.
vaginoplasty, breast augmentation, all of these, even like facial feminization surgery, right? Getting the payment for that, feeling comfortable with their selection of provider and whatnot. So, yeah, we just do it really comprehensively. It's a service that when I started out, right, like I didn't know what a deductible was, right? And like no one really teaches you what a deductible is ever, right?
Yeah.
So that's
No.
something you sort of learn more or less experientially, right? And when I, thought of this service, I had done it for like a couple friends, one or two, right? And it really helped them, right? Um,
Oh,
and that's
yeah.
something that like
Mm.
I figured that a lot of other people need. And it seems like
Mm-hmm.
that has held true.
Yeah,
It's so
exactly.
important. Like, I'm 3.5 months on T, and I would not be on T at all if my husband hadn't been an advocate for me.
Yeah,
Like, he found the doctor, he made the appointment, he made it work.
yeah, like with medicine, there's a lot of, like any real field, there's a lot of things that are complex, right? Even your car insurance is really complex, right? You buy like short-term disability insurance, you buy any type of insurance, right? It's a hugely complex document. This with a number of regulations, right? That really even people who work in the industry don't really get either.
So did you learn all of this through like accessing your own services, or like was it because your friends needed help, or did you already kind of
It's a combination of
dip your
all of
toes
it.
into it?
Um, I have worked in like medical administration. I got very comfortable, doing a lot of those sort of like back end things, like especially like looking at claims, looking at authorizations, looking at, talking to insurance from like a provider point of view, right? That wasn't necessarily like trans specific. But yeah, doing it for myself, right? Like, but one of my big moments was, figuring out how to get a hair transplant for myself, right? I already had a pretty decent amount of background in that. And, I was like, took like 3 months of sort of like extended, prolonged calling, but, I got that hair transplant.
Mm-hmm.
Which is a service, A, that not a lot of people know about, B, is very decently difficult to get, right? And also, seeing that I can help others with this knowledge, right? That not everyone starts out with this knowledge and, or, wants to acquire this knowledge, right? Which is, totally okay, right? And should be fairly acceptable. But there is that sort of like barrier that, having someone who specialized, that would have helped me. And, you can't go back in history to change that, but you can help others.
I
Yeah.
love that.
Mm-hmm. That's a pretty common trans experience. I think like so many of like the vocal coaches out there, like same thing, like they struggled through it. And then kind of, it's like I finally developed this like skill after like having to suffer through the thing. And then you find yourself with the ability to like actually be able to help other trans people through it, which I think is like just continuing trans joy.
Yeah, I think it,
Yeah.
it gives you that ability to like empathize, right? I think that's a big thing.
Yeah.
Because like I've been through that struggle too, right? Um,
Mm-hmm.
it it's kind of interesting, right? It's one of those things where like you get some sort of like fallback where like helping clients helps yourself, right? Because now you know how to deal with
Yeah.
so many things, right? And it's
Mm-hmm.
just this sort of like very nice positive feedback loop that builds and builds and builds.
I had a little bit of experience with a patient advocate, not in the same sense that you do it, but like my employer does some reimbursement for like certain gender affirming procedures that most insurance companies won't cover. In my case, it was the laser hair removal. And like in the process of like going through that, I had like a patient advocate through my company who worked between my company and like the insurance companies and like the person providing the service. And I just like got to see them like through the background doing all this paperwork and making the phone calls and sending the emails and everything. I was like, I'm really glad that I have somebody helping me with this because like for that one thing, the one of many things that we like use for gender affirming care, just like so many steps and so much bureaucracy involved.
Yeah, like, patient advocacy is a decently, from what I understand, a decently like small sort of like industry, if you will. Um, Even just with any other condition, right? A lot of people are very sort of confused about how their insurance works and how to get a certain procedure approved, and that's even sort of more magnified with gender affirming care, right? Where there is not a lot of knowledge on the part of the providers, not even a lot of knowledge on
Yeah.
the part of insurance representatives that you might talk to, just not a lot of knowledge in general. um, and health insurances as well as hospitals have started to have patient advocacy programs. Some of my clients say that they're helpful, some of my clients say that they're rude or demeaning or some other version of not helpful. And personally, right, like I've also interacted with some of those individuals, and some of those individuals care, and some of those individuals are there to do risk mitigation, basically, right, for the company, so that
Mm-hmm.
again,
Health administration in general, healthcare in
Mm-hmm.
general.
yeah, like really they're there so you don't sue the company, right?
Yeah.
So
Mm-hmm.
that you don't go to the step of getting like a healthcare lawyer to sue the company, because it's like a huge financial liability on the company side, right? Like,
Yeah.
I think that something that like some of my patients have talked about is that even if there's like an insurance advocate or something, right? They only can do so much, right? Like they can't help you with everything, right? They can't help you find really providers, right? And I think one of the big things is they have such a huge caseload, right? I remember even like my personal like health navigator at my own health insurance, right? Her caseload like doubled, right? Just like overnight because of that sort of like corporate decision.
Mm-hmm.
And do you offer services like nationwide in the USA?
Yeah. So basically, all of our services are virtual. We don't really have a need to meet in person because it's phone calls, paperwork,
Right.
whatnot. Um, we've helped clients with so many different types of health insurance, right? Employers from all over the country, right? Some East Coast insurances, some West Coast insurances. I haven't had like a middle of America insurance yet, but hopefully we'll get to that. Um, yeah, but nationwide, want to help as many people as possible. Been reaching out to trans people all around the country, or like trans providers all around the country. New York City, San Francisco, LA, sort of like usual suspects.
Mm-hmm.
That's so good because,
Yeah.
especially in middle America, they're going to need a lot of advocacy uh, real soon.
Yeah, I think it's a lot on the like. It's going to be really difficult, right? Like on the like state legislative level. It's actually quite interesting. The differences company to company, state to state that are in where the like current state of trans healthcare is.
Have you run up against anything in terms of like legal roadblocks, government roadblocks? Like,
In some sense, yes, right? Like a lot of our clients do tend to have somewhat okay trans healthcare protections, right? Even like there are some currently, at least, right, some sort of like baseline things that are pretty well covered now, even by like states, like at least for adults, right? For like states, even like Alabama or whatever, right? It was like a personal curiosity dive. I went in and like looked at the medical policy for one of the Blue Crosses of one of the states that has been trans healthcare for minors in some capacity. Things like vaginoplasties and whatnot. I think some sort of like transvascular bottom surgery as well, or at least transvascular chest surgery. Um, there's some coverage for that. The hard part, with every single insurance is what don't you cover, right? And historically, when there wasn't, as much agreement or determination on, what should be covered, it was a quite arduous process, right? And you do have to, in the end, sort of like retain a healthcare lawyer to actually go and sue that company for some breach of violation of law.
Mm-hmm.
I think like something that I've come to the terms with, right, is like on the advocacy side, right, I want to help the patient as much as possible, right? But there are certain things where, yes, you'll have to engage that lawyer, right? Yes, you'll have to, fight for that legislative change, right? Or fight for that change at your company or whatnot. And that's something, that's rather daunting, right? But as trans people, I want to support the trans people that I help, right, as much as possible.
On the note of accessibility, I was curious if you had thoughts about the mail order services for hormones like Folks or Plume.
They're decent services. I think one of the things that, Folks and Plume are limited by, just like everybody else, right, is law, right? Every single healthcare provider is limited by whatever the law says in the state and the municipality and the nation, right, where they provide healthcare. Folks and Plume, help improve that sort of like accessibility. You don't necessarily need to go to like a physical provider, right, if that's some sort of barrier for you. I think they started to take some insurances. They used to be like self-pay only. So that's, really, really helpful. That specialized service might help some, but there is also, the option of primary care, right? Especially a lot of these like younger doctors are very, very, very willing to prescribe HRT, as long as you find the correct one, right? Some older doctors, some, you know, certain types of doctors won't be willing to, but as a patient, you're allowed to shop, right?
Mm-hmm.
You're allowed to shop for your primary care doctor, right? And hopefully you'll find the one that will listen to you, listen to your needs.
And sometimes it takes a long time, in my case, 6 years, but it is worth it when you do find that one doctor. It is so worth it.
Yeah,
Yeah.
like, I remember working in clinics, right? And apparently this training to actually prescribe HRT is like a, less than a week kind of training. And some of these like older doctors will refer you to an endocrinologist, right? Which is kind of the old guard in some sense way of prescribing HRT, right? But like HRT, at least presently is not hopefully so much of a daunting task in certain places, right? There's so much difference that you have to have that unfortunate qualification.
Yeah, and certain insurances.
Yeah.
Yeah. When I was working on getting my HRT, the first person I talked to was my primary care physician. And she was like, I would love to help you, but this has never come up for me before. And I've never had to look into that. I was like, okay. Um, so like I kind of had to search around on my own because she just like literally didn't have any like framework for what I would do. So I ended up finding my own endocrinologist. But I did use Plume for 7 months because, specialists, like I was put on a 7 month waiting list to get that first appointment. And of course, now if I want to make an appointment, it's like, whatever, sure. But like, the first patient, it's like, are you good? Like next July. So yeah, I think there is like a knowledge gap issue for sure.
Yeah, like, Plume's a great service for that, right? Like a lot of these like online doctor services, they provide that sort of like bridge and accessibility, right? Because that's really what their model is, right? It's easier than going to the doctor. It's video, it's available, it's, whatever. It seems like a lot more providers, especially younger providers, are willing to, take the class. It seems like it's mostly young women providers as well, um, who tend to like empathize and actually, care about, anything that relates to trans healthcare.
Mm-hmm. I've noticed that as well. In general, I will say the doctor who prescribed it to me is a fabulous gay man, and I love him very much.
Mm-hmm. Yeah, I think he also does, or at least did, do some work through Plume too, because like
it's the same name.
Yeah, so when Ben told me like who his doctor was, I was like, oh my God, I had him too for a little bit. He's like a great guy though.
He's wonderful.
Yeah.
When it comes to people who are feeling lost in the healthcare system, like, what's a word of encouragement you might give them?
I think
it's a big question.
I think that, the simple word of encouragement is there's always like a next step, right? You have a block with an HRT provider, find a different one, right? You have a block with the health insurance, you have another stage of appeal maybe, right? You can find a different insurance maybe, right? One thing, especially with healthcare, right, is that there is always more to discover, right? It seems, particularly in my experience, right, from like a top down level, there's a lot of sort of like profit motive extraction, right? From a bottom up level, there's a lot of people who, they don't really have any sort of like malintent, right? As like employees of the healthcare organization, they just don't know, right? Mm-hmm. And so you have that power to learn, right? To advocate for yourself, to find light in that maze, right? Mm-hmm. And there's always, some sort of exit.
Yeah, and if they feel really lost, then they can turn to places like Flourish Advocacy, or if that isn't feasible for them, I'd hope that they have someone in their life that they trust that they can like enlist to help be their advocate.
Yeah, like I think one of the things that, stifles a lot of people is knowledge, right? With American health insurance, any type of care you want to get is work, right? But with the knowledge, right, by equipping yourself with the knowledge, right, you can actually succeed in this, right? And that's something that I think, is decently comforting for myself and my clients, right? Like, I think for me, that moment came, especially with that like hair transplant thing, right? By knowing all of this, you got this care that was worth like $40,000, right? For pennies. And so that knowledge, like, you can overcome that barrier.
And I've seen on TikTok that you do trans healthcare workshops. Is that something you do on a regular basis?
We don't do that on a regular basis. We've moved more towards that sort of like working together with individuals, right? Because we found that being able to, work together with individuals with their specific needs, right? What their specific desires are, the impact of that is a lot greater, right? Because like, I don't know, I've felt that I've been able to, empower my clients to understand a little bit more about how their own healthcare works, how to advocate for themselves, right? I've had clients that on calls with me and they've been able to, listen to how I talk and get that sort of like experiential aspect. So we serve a whole range of different clients, and I don't know, I think that's just been really sort of like powerful.
Yeah, that makes sense because every transition is different. Everyone has different goals. Mm-hmm. So it would be hard to generalize because we're all so unique.
Yeah, there is such a huge knowledge issue, like just communication issue. Because like the only reason that I knew that people like you exist, like doing advocacy, is because of TikTok. Like I didn't have anybody like within the medical establishment, a doctor or anybody who would have ever brought that up. I didn't have a source to find this information out about, except for that I just happened to be on social media at the right time. And like, that kind of service can be just massively helpful, even just for the opportunity to have one like sit down meeting with somebody and just be like, how does trans healthcare work in general? Because it's like very daunting if you're out there on your own and you don't have people like helping you figure this stuff out.
Yeah, like, I don't know, it's really nice, what we do is, like, in that sit-down meeting, right, we intake the clients, and it's really, sort of like heartwarming to see at the end of that conversation, right? Devising a plan for them, telling them, this is how you get the thing that you want, right? I will help you every step of the way, as much help as you want, as many stepping stones as you want, right? And, after every meeting, there's this like sigh of relief, right?
Yes. That was my experience too. Just like with my hair removal, I had that first meeting, like I don't know, a 10-minute phone call or something. And after that, I just like felt this rush of relief. I was like, I was right. That is complicated. And I have somebody who's watching out for it now because it's a lot. And I lack in the executive functioning area. Many of us do. Um, but it's a lot to have to handle on your own. So,
Yeah, like I've conceptualized, insurance just like a big sort of like book, right? Uh, you have to sort of like read through that book to really like get what it says, right? And that's really like confusing, daunting for some people, right? Because it is a sort of like systematic knowledge. It's impacted by so many regulations, right? Every plan is like incredibly different, right? Because it's designed by the state, designed by your company. How big is your company? How much money does your company want to pour into you as like an employee, right? It's a little bit sad that there's so much sort of like fragmentation and sort of like disparity, right? But the goal of really our organization is that knowledge is in some sense power, right? And you can extract the maximum value from your health insurance, right? You can get it to pay for all these services, and that's I don't know, that's just really nice.
You seem like a
yeah.
superhero.
Um,
I think it's really cool that you're doing
Yeah,
this
it's
and that you know so much about it and you're sharing.
yeah. I mean, I don't. I'll have some humility here, right?
amazing.
Yeah. I don't know. Like, I think as you mentioned, right, providers don't know about this, right? Insurances have their own version that they don't really tell you about, and sometimes it's not very good, right? Um, no one really has done this, right? Even the sort of like inter-trans community knowledge, whatnot, is actually rather fragmented. There's a lot of sort of like self-internet research, a lot of, and that, of course leads to some sort of like misconception or faltering, right? A lot of our clients have done that exact same thing and been like, I have no idea what's going on, right?
Yeah.
It's really difficult to, parse. It's one of those things where health is so critical to especially like trans people's lives, but you have to be forced to sort of like read and understand and comprehend and interact with this like very foreign thing.
So we're going to get a little bit heavy. At the time of recording, we are 10 days past the 2024 election. And we've been processing a lot of things. Not that the situation is necessarily a surprise to us, but we're like quickly being thrust into this position where we're like, we really need to start like preparing for the future, thinking about what needs are about to arise or may not arise. First of all, do you have any like first reactions, like as far as like how this may or may not affect trans healthcare? And
I did see your TikTok about it, but
Yeah, I did make a TikTok about it. I'm
yeah,
good. I forgot to post part 2 of that. Um, so, policy is something that I wish I could, dive into the deep annals of the Republican Party's like information technology systems, right? But I can only dream. Um, but from my sort of like perception of what the future looks like is, how the future kind of looks for a lot of reproductive healthcare, right? Or a lot of sort of like gender-based, rights or whatever. The access to that becomes a lot more state by state. You see that fragmentation already now. Access to trans healthcare and different types of trans healthcare is incredibly different state to state. You have, bans for trans healthcare for minors currently in, I don't remember which states, right? But a decent sort of like, I think it's at least currently still minority of states banning, especially trans healthcare for minors will get easier because there's less sort of like federal government oversight of that. My sort of, broad scale recommendation is it's never a bad time to get surgery, right? If you're thinking about, gender affirming surgeries, especially now, right? Both as a sort of like political future thing and also just sort of as a, it's a nice thing to get over with, right? If that's something that you want.
Mm-hmm.
There is, at least in some sense, a sort of progression that it seems like there's being taken state by state, or sort of like, children to adults. And, the sort of like substance of the TikToks that I made, Project 2025, right? I haven't finished the whole thing in all actual transparency, but I did read the whole like Department of Health and Human Services section. And it was actually quite sort of notable how little they mentioned like gender ideology, gender something. I think in the whole book it only comes up like 100 times, right? The word like gender.
And that's like 600 pages?
It's like 900 pages.
Oh, dang.
Yeah.
So I remember two specific parts. One was that they want to issue a stronger national coverage determination through CMS, Centers for Medicare Services. So, trans healthcare potentially on like Medicare and Medicaid will become a lot harder to get, right? Especially Medicare. It's already pretty decently hard to get it on Medicare. Potentially, one hope is that even if there is this sort of like fragmentation, right, where there's a lot of sort of increasing disparity between what different states will cover, even if like federal Medicaid dollars cannot be used for gender affirming care, there may still be some state leeway to use their sort of like dollars and cash reserves for services that states think are helpful, like potentially gender affirming healthcare, or to comport with like their own state's laws. We see this especially with like abortion, right? Which seems to kind of like tell the course for, other sorts of like reproductive or gender-based healthcare. Federal Medicaid dollars can't be used for abortion and basically any other case instead of, if I recall correctly, rape, incest, or threat to life of parent. But, a lot of states do have that sort of like protection, especially a lot of the lean blue states, if you will, do have that sort of like protection, and they can't use any federal Medicaid dollars for it, but they do contribute some of their own like whatever state taxes, right, to actually fund that service. It's not a perfect solution, right, but it's not like, Rome is falling tomorrow. I guess it's somewhere between those, and that's, maybe some version of the silver lining.
Mm-hmm. In its current state, what are health insurance companies required to provide as far as federal law goes?
As far as federal law goes, there's no specific protection, right? Federal law with regards to insurance is rather sort of baseline. For plans issued through state marketplaces, they have to comport with like the Affordable Care Act, right? Which, requires things like preventative care, coverage for sort of like very broad general categories like preventative care or primary care or specialty care or whatnot. State by state coverage is very, very different, right? And especially this is how you get a lot of that disparity between employer to employer because, regardless of what state you live in, if your employer is in like Texas and buys a Blue Cross of Texas plan for you, that regulation, regardless of where you live, is going to be incredibly different than if they buy like the Blue Cross of California, right? Like depending on where they buy that insurance and what that specific company's regulations are and what they as the company want to do, right, potentially for their own sort of like profit baseline bottom line. I think the both sad and potentially helpful reality of trans healthcare is the regulations scheme is very fragmented, right? State by state, insurer to insurer. There are some things the federal government can do, but they already don't control a certain part of that regulatory scheme.
Yeah, I saw a lawyer on Monday to help me with my name change, and he's awesome, and we're interviewing him next week. But he was telling me that one way that HRT differs from abortion care is that anyone of any gender identity or like cis or not cis may need it, and the FDA can't tell you how to prescribe it. It can only tell you whether you can or can't. So like they can just say you can't prescribe abortion drugs in this state. But as far as like, there's cancer survivors who have lost their reproductive organs that are cis that need HRT. And then also trans people who've had those organs removed that need HRT. So he seemed to be very optimistic about at least HRT accessibility in the future, not getting much worse than it already is, hopefully, at least for adults. Just depends on the doctor.
Yeah, I think I'd like decently agree with that. I'm not so in tune with like the regulatory scheme in terms of pharmaceuticals. The government cannot really just, the thing with government is it's very complex, right? It has to pull a certain lever to do anything it wants to do in terms of like goals, right? So the government can't just go like ban estrogen, ban testosterone, ban spironolactone, ban minoxidil or whatever, right? These like different sort of like pharmaceuticals. They have to use something that already exists to create that effect, right? And one corollary I like giving is the way that the federal government got every single state in America to raise their drinking age from whatever it was to 21 was to say, for every state, you can keep whatever law you want, but you will lose a certain portion of your highway funding if you don't pass this law, right?
Yeah.
It seems like even if there is that sort of like, one, it's a legislative mechanism, right? And there's a sort of like slothfulness to that. Two, even if that mechanism is like passed, like there are some states that seem like they are willing, whether to comport with their own state law or just for, some sort of political capital, are actually willing to take the hit, right? I don't remember, but I just learned about this actually from Project 2025, which was kind of, funny. Apparently, California got like some like $100 million stopped from one of its like government health insurance sort of like allocations for I don't remember which violation it was, but they just took that hit. And then in like 2021 or 2022, the Biden administration like reinstated their whatever money they had like been docked by the Trump administration. But it seems like some states are actually willing to take that hit, which may, help preserve that sort of access. And also, a lot of American health insurance is based on employers. And what a lot of employers, especially large employers, will do is they want to incentivize, from just the company's perspective, you to work there. And by not, providing HRT, that is a potential liability to that company from a PR perspective, from, whatever perspective. And even now, a lot of these companies cover more than they're required to, not because it's a legal requirement, but because mostly for employee retention, which, is not necessarily fully benevolent, right? But it's acceptable enough when you are the employee who sort of receives that, action. And if you want to interpret it as benevolence, you can.
I mean, access is important. Whatever their motivations, if they will give me access, I will take it for sure.
Say you're a trans person who's just like in the process of starting transition now, or maybe just came out in the past few months. We've got a few people like that in our community. And you don't even know where to get started as far as medical transition goes. What advice would you give somebody in that situation to like just get started, aside from just Googling trans healthcare,
I think it really, when you first start out transitioning, there are a lot of questions, right? Because like, it's a shift of a certain scale, right? It's different for everybody, right? For a lot of people, it's a massive, like psychologically excruciating shift, right? For some, not so much. Either way, that does require consideration from like a trans healthcare perspective of like, what do I want? Do I want hormones? Do I want surgery? Do I want, therapy? Do I want, all these sort of like trans healthcare options that are available to you, right? So one of the things that like, especially I help my clients with that are just starting out is literally just figuring out, what do you want, right? Like, there are questions that I can't answer for you, but I can help you answer those questions, those sort of like soul searching questions of what do you want to be, what sort of trans healthcare do you want to access, right? What do you want the structure to look like, right? What do you want to prioritize, right? Who do you want to be in that sort of like respect? of course there are like no wrong answers, but that's really the first thing, right? Because if you don't know what you want, you can't go out and search for it.
Mm-hmm.
I just saw something come up in a support group I'm in today where someone, I don't know if this is something you'd even be able to weigh in on, but someone was wondering if they should disclose that they are trans to their provider because it was a Catholic system. Is that something you think people should be worried about going forward?
I think it would be, right, and this is not like legal advice, but I don't think that there would be a very persuasive mechanism for the government to come and take your medical records unless you are like suspected of a crime or something, right? To subpoena your records specifically, right? There are sort of like patient privacy laws that there is like some amount of compliance for, right? HIPAA, everybody probably is at least sort of like baseline familiar with HIPAA. You know, disclosing you're trans often might help you with some of your care, especially like disclosing you're trans might be incredibly relevant to other aspects of your care, right? Sort of like, you know, care for your chest, right? Care for, you know, like if you've gotten like gender-affirming genital surgery, right? Like those differences, right, actually do matter in a sort of like medical sense, right? And you want to make sure you get appropriate care there. My thought is that if you are scared that disclosing you're trans to some provider will put you in danger with that provider, don't go to that provider.
Very good advice. That is not legal advice. I agree.
Yeah.
I will also say that not all people working within Catholic healthcare systems are Catholic. That just maybe happen to be where they have a job, and you may find a really strong ally in those if you look.
Absolutely.
But whatever people are comfortable with, I think, is the right answer.
Yeah.
Robin, do you have any more burning questions? Because we're almost out of time.
I don't have any more burning questions, but we will put links to your website, just all your contact information. We're going to like link people to like both in the show notes and in the Discord.
And you're already linked in our Discord.
You're already linked in our Discord. So are there any other like resources that you'd like to plug for anybody who is like in need right now?
Or just anything you feel like you didn't get to say that you want to have heard?
You know, if you are having trouble, you know, with gender-affirming healthcare, of course you can reach out to us, right? There are options available, right? You have, particularly like health navigators at insurance companies. Those are always someone you can try, you know, who some of them are on your side, right? Some of them are sort of like mean and demeaning, but that's kind of like a, you know, a gamble that is worth it to take, right? I think really the message is the best thing you can do is equip yourself with knowledge and to, you know, not be afraid, be conscious of course, like ramifications, right? But in like healthcare access, there are not a lot of ramifications, right? So you have that sort of like space to be courageous and sort of like speak up for yourself or find someone to, you know, speak up on your behalf, right? I think the final parting message is it's possible, right? You know, you might have to go to greater lengths to get it, right? Some of my friends took, you know, a decade to get a surgery, but that is possible.
And it's worth it. It's worth the wait.
Worth it.
Yes.
Right? There's a way out. Right? That's the message.
You're amazing.
Thank you.
Yeah. I agree. I'm so glad we were able to meet you and have this talk. Like I said, we will make sure people know how to get in contact with you. You may be a little bit busier in the coming days, but
yeah, I might end up reaching out to you not too long from now because my insurance is going to go wild.
Yeah. Always looking for more.
Yeah.
Yeah.
Absolutely. All right. Well, Ivy, thank you for joining us.
Thank you. It was really lovely to meet all of you.
Yeah,
it's so lovely to meet you.
Absolutely. Well, thank you for joining us.
Thank you so much.
All right. Bye.
Bye.
Bye. Shall we do an outro?
We should do an outro.
Want me to do it?
Yeah.
Thank you so much for listening to Ben and Robin Are Trans, interviewing Ivy from Flourish Advocacy. I'm Ben and I'm trans.
I'm Robin and I'm trans.
And check out our Discord. We'd love to have you in our community. We need to be stronger together. And what is your favorite catchphrase, Robin?
Solidarity forever. Trans
Yes.
solidarity forever. Have a good week. Take care of each other.
Yeah. Bye, everybody.
Bye, everyone.
You deserve honkin' bazongas. The honkin' bazongas of your dreams.
They can grow up to like 3 years. That I feel like I'm talking about like wildlife. But yeah. So we'll see.
And here we observe the boob in its natural habitat.
The booba.